Healthcare is a topic that is at the forefront of just about everyone's mind. When we think healthcare, we think caregivers, doctors, nurses, therapists, or anyone that is directly involved with our physical or mental health. We are often quick to forget that total wellness encompasses body, mind, and spirit.
As a chaplain, I provide support and guidance in holding the spiritual healing that is within the tradition, experience, and culture of those I minister to. So I think about the times in which I minister to couples who experience the most difficult time of their life, that is the death of their child before the child is born. And spiritual healing comes when they find meaning in honoring the child by name, finding meaning in the life that was within the womb, and ritualizing that experience.
Board-certified chaplains are professionally trained spiritual care clinicians. The role of a chaplain is to provide comfort to patients and their families in the midst of a health crisis by getting to know the patient and understand how they are dealing with their condition.
Within healthcare, chaplains have the awesome opportunity and responsibility to be with patients at the most difficult and challenging times of their lives, whether at the beginning of life, during a trauma, or even at their final days. The chaplain is with them in a way that helps them discover Christ's compassion, courage to be in the suffering, and meaning, ultimately, in their lives during this most difficult and challenging of times.
Chaplains become part of the clinical team in a hospital setting. The medical community understands the benefits chaplains provide in the care of their patients. They recognize that healing goes beyond cure, spirituality is beyond religions, and relieving suffering goes beyond tending to pain.
They respond to our trauma team activations, and from my standpoint, that's their most important role. We see the worst of the worst patients coming into this center. We are prepared for them with an activation team. The chaplains are part of that team. They help the patients, they help give spiritual and emotional support to the families under very adverse circumstances, and they support our staff when we're ready to wind down afterwards. And we like to think of our chaplains as being the best part of somebody's worst day, and we appreciate them greatly.
He has shown the strength of his arm and has scattered the proud in their conceit.
The chaplains of the National Association of Catholic Chaplains embrace this healing profession as a ministry, rooted in, animated by, and continuing the healing ministry of Jesus in the name of the Church.
Chaplains, as continuing the healing ministry of Jesus, are oftentimes a reconciling presence to the patient. As the patient accepts his or her illness, as a patient may have to deal with brokenness in family, or perhaps a patient dealing with his or her circumstances in the hospital, ultimately coming to terms with their own life, the meaning and purpose of their life. And so in that way, the patient is often experiencing the chaplain as a reconciling presence.
The National Association of Catholic Chaplains has been in existence for nearly 50 years, and today includes women and men of all ages and backgrounds, serving from hospitals to home settings and supporting both patients, their families, and caregivers alike.
You know, chaplaincy is a wonderful profession in which the chaplain has an opportunity each day to make a difference in the lives of patients, family members, and clinicians. Board-certified chaplains come from diverse backgrounds, with some folks entering chaplaincy as a first career and others coming in later in life. Also, a board-certified chaplain has a master's in theology or a master of divinity and on-site training in clinical pastoral education.
People's whole lives are disrupted by a health crisis, and chaplains help them come to peace and find meaning in their time of need, as well as provide support and guidance to the staff on spiritual and ethical issues.
We're very proud to be able to offer chaplaincy services at St. Anthony Hospital. We believe in taking care of the whole being, body, mind, and spirit. Our chaplains are able to take care of our patients and their family members at their most emotionally vulnerable period in their lives. When they're stressed and trying to determine how they're going to deal with an issue, our chaplains are able to address both their emotional and their spiritual needs. That's a very distinctive advantage that we have in taking care of our patients and in our population in our community.
It's been a real privilege for me to be a chaplain and to be with people in the most profound moments of their life. And these are moments such as birth, death, and health crisis. But it's the privilege of being there in the sacredness of it, because in these profound moments, we discover what's core about us being human, that is finding meaning in it. And for me, I'm privileged to walk with people as they discover that meaning.
As the healthcare environment moves from responding to episodic care towards managing wellness and disease prevention in populations, caring for the whole person is becoming more essential, regardless of the philosophy or model of care being utilized. At the heart of a chaplain's work is attention to the human spirit in the face of illness or injury. To learn more about the National Association of Catholic Chaplains and the work they provide, call today or visit nacc.org.